We are joined now by Admiral Brett Giroir, the Assistant Secretary of Health and Human Services and a member of the administration's coronavirus task force. Admiral, good morning. It's good to see you.
Good morning. Thanks for having me on again.
We just laid out the situation here across the country where cases are on the rise in almost all of the states. How disturbed are you by what we're seeing? How serious is this?
Well, thank you for asking that, and the lead-in was very good. As the nation did after Memorial Day, we are at another critical point in the pandemic response. As you pointed out, cases are going up in most states across the country. Hospitalizations are up, although we're still tens of thousands of hospitalizations below where we were in July, but that is rising, and we are starting to see the increase in deaths. But I do want to emphasize that as we did in the Sun Belt, as we did in the Deep South, we can control the virus. We know how to do that. Smart policies, very critical to wear a mask when you can't physically distance. Avoid crowds, like those indoor crowded spaces, wash your hands, and very importantly, we have more armamentarium like the 36 million tests, these Binax tests that we've already sent out to states so that we can identify those who may be symptomatic or even asymptomatic and spread the virus. So we're taking this very seriously. We had a coronavirus task force yesterday meeting, also had a doc meeting late into the evening last night. We have the tools to combat this. We can control it, but this is a very important time to do it.
Yeah, you said yesterday in an interview that the situation is tenuous, and that word really struck me. I wonder if you feel that we are at a precipice right now, where if we do the right things, we can stave off disaster. But if we don't, we are looking at a very, very dark period of time coming up in this country.
You know, I wasn't an English major, but tenuous seems like the right word. And you framed it just right, Savannah, is we still can control this. By the types of smart policies, wearing a mask, those indoor spaces, avoiding crowds, being very careful around the holidays, and having more testing. But if we don't do those things, it may force local officials or government officials in the states to have more draconian measures because cases will go up if we don't make a change.
Are you frustrated by that?
The virus isn't acting on its own.
Yeah, you know, it's so interesting because we hear, you know, everyone in the administration, you know, the doctors all sing with one tune about wear a mask, wear a mask, wear a mask. There are mixed messages coming from the very top, from the president. I don't think there's any doubt about that. Does that frustrate you?
Look, I have a job to do like the other docs, and we're going to try to give the American people the best evidence possible. Americans have done a great job. Mask wearing is up across the country, so Americans are listening. And what I want to emphasize is that we will have a vaccine. We will have a safe and effective vaccine. It may be this month, it may be next month, it may be in December. This will not go on forever. The vaccine will end the virus pandemic. But until that time, we have to do what we can do, and that's those simple mitigation measures, wearing a mask, avoiding crowds, especially indoors, wash your hands, and please increase testing. We're only using about a third of our nation's testing capacity now. We do need to test more people, especially in these outbreak areas. We have surged to 8 different cities now, our surge federal sites. 2 started last week, 6 are starting this week. We're talking with 6 more locations for next week to actually surge in testing, sometimes door to door. So if we do these things, we can defeat the virus.
Yeah, can I jump in and just ask about that? Because the president just tweeted yesterday, cases up because we test, fake news media conspiracy. But you were very clear yesterday. You said this is not a function of just doing more tests. These are real cases. This is a real serious surge that we're seeing. Can you explain how you know that it isn't just that you're doing more testing?
So let me make 2 points. Compared to March and April looked like the cases were much lower than we have now. That is probably false because the testing wasn't sufficient to detect all the cases. So, but between July, August, September, October now, we do believe, and the data show, that the cases are going up. It's not just a function of testing. Yes, we're getting more cases identified, but the cases are actually going up. And we know that, too, because hospitalizations are going up. Now, the peak was in the 70,000s in July. We're at about 42, 43,000 now. So we're much less in July, but those are going up. Those are real. And we do know that deaths are increasing, unfortunately. So we do assess that the cases are actually going up. They're real because hospitalizations and deaths are starting to go up again. We can reverse that. I just want everybody to know nobody's wearing the waving the white flag. The American people can make a difference. You've done a great job. Americans have defeated this before in July and August. We have to do the same thing now because, as you said, we're entering the winter period. There's more chances to spread, particularly indoors in small gatherings. But we can stop that until we get that safe and effective vaccine, which is around the corner. It may not be this month, but it's going to be soon. And if we have a safe and effective vaccine, we are already manufacturing millions of doses so the American people can get it as soon as it's proven to be safe and effective.
Well, it's a critical moment, and I appreciate your time this morning, sir. Thank you very much.
Thank you.